Welcome back to another episode of HealthCap Weekly Wrap.
Yeah, this week there's a lot happening, starting with some big changes from CMS.
Right, they're reordering nursing home deficiency posting so the most serious issues show up first. And there's also new guidance on PBJ reporting for remote workers.
We're also diving into updated PAD treatment guidelines, a new study on diabetic foot ulcer recurrence, and some really practical tips for medication adherence and drug disposal in senior living communities.
Plus, we'll wrap up with a closer look at biologics, biosimilars, and oral phosphate binders. Some valuable insights for clinical teams and care planning.
Did you see the news from CMS about nursing home deficiency postings?
Yeah, I did. McKnight's is reporting that CMS is going to start listing the worst deficiencies first on inspection reports.
Right. Instead of having to dig through all the details, survey results will show the most serious violations up front.
That's a big change for transparency, and it's going to make it a lot easier for families, residents, and even prospective staff to see how a community is performing.
Absolutely. And for senior living leaders, it means there's no hiding the tough stuff. You have to address those higher level deficiencies quickly and effectively because they'll be the first thing everyone sees.
Exactly. It's also a reminder for administrators and care teams to stay proactive with quality assurance and staff training. The last thing you want is for a preventable issue to be the headline on your public report.
Yeah, and McKnight's emphasized that this is part of CMS's push for stronger oversight and accountability across the sector.
So, for our listeners, this is a good time to revisit your last survey, identify any high level tags, and make sure you've got a solid corrective action plan in place.
So, one of the clinical updates this week comes from McKnight's, and it's about the new treatment guidelines for PAD, peripheral artery disease.
Yeah, I saw that. The big takeaway is the emphasis on dual drug therapy combined with exercise as a standard part of treatment.
Right? And what's interesting is how they're prioritizing structured exercise programs as much as medication. That's a shift that could really impact resident care plans.
Absolutely. PAD is so common among older adults, and when mobility is already limited, having a focused exercise plan can help prevent complications like ulcers or even amputations.
And the dual drug therapy approach means residents might be on both antiplatelet and cholesterol lowering medications. It's another area where medication adherence is going to be really important.
Exactly, because if one part of that treatment plan falls apart, whether it's missing doses or not staying active, the outcomes can suffer.
For senior living teams, this might mean coordinating more with therapy departments or wellness programs to make sure residents with PAD are getting that movement built into their routine.
Yeah, and like McKnight's pointed out, the guidelines really highlight a more proactive, lifestyle inclusive approach rather than just relying on prescriptions alone.
Another clinical piece that caught my eye this week was the study on diabetic foot ulcer recurrence, also reported by McKnight's.
Yeah, the researchers found that measuring skin water loss, basically how much moisture is evaporating from the skin, can help predict whether a healed ulcer is likely to come back.
That's fascinating because it gives clinicians a simple, non invasive way to monitor a resident's risk before the wound actually reopens.
Exactly. For communities, this could mean that wound care teams and nursing staff can spot trouble earlier and take preventive action, like adjusting footwear, skincare routines, or even nutrition.
And when you think about the complications that come with diabetic ulcers, pain, infections, even hospitalizations, this kind of early warning system could be a game changer.
Right, McKnight's made the point that this is really about preventing the cycle of recurrence, which is often one of the biggest challenges in managing chronic wounds.
So, for our listeners, this is a good reminder to keep an eye on new tools and technologies for wound care. Even something as straightforward as a skin moisture measurement could make a big difference.
Moving on, medication adherence is one of those ongoing challenges in senior living, and PharMerica's latest e-guide really breaks it down.
Right? They highlighted that non adherence isn't just about forgetting to take meds, it can be caused by side effects, confusion over complex regimens, or even just the number of pills a resident is expected to take each day.
And the impact is huge. PharMerica points out that poor adherence can lead to more hospitalizations, worsening chronic conditions, and even higher costs for communities and families.
One of the things I liked about the guide was the practical strategies, like medication reviews, simplified packaging, and staff education to help residents better understand why they're taking each medication.
Yeah, and they also stressed the importance of communication, both with the resident and with family members, to keep everyone on the same page.
Exactly. When staff know what barriers a resident is facing, maybe it's trouble swallowing pills or they're worried about side effects, they can step in and find solutions.
PharMerica really framed this as a team effort, where nurses, pharmacists, and caregivers all have a role in keeping residents on track with their medications.
Another key piece from PharMerica this week focuses on drug disposal in skilled nursing communities.
Yeah, their e-guide lays out the steps for disposing of unused or expired medications in a way that's both compliant with regulations and safe for the environment.
Right? And this is an area that's easy to overlook. But improper disposal, like flushing medications, can lead to environmental contamination and even regulatory fines.
PharMerica emphasized that having clear protocols and staff training is essential. Things like using secure disposal containers and partnering with authorized take-back programs make a huge difference.
And beyond compliance, it's also about reducing risk in the community. If unused medications aren't disposed of properly, there's always the possibility of diversion or accidental misuse.
The guide really drives home that safe drug disposal isn't just a checklist item. It's a critical part of protecting both residents and staff.
For senior living teams, this is a good time to review your disposal practices and make sure you're following both federal and state guidelines.
Another great resource from PharMerica this week is their guide on oral phosphate binders.
Yeah, it's a really helpful overview of the different types, like calcium based and non calcium binders, and how to choose the right one for each resident.
Right, and they break down key considerations like dosing schedules, side effects, and pill burden, which can be a big factor for adherence.
Exactly. When a resident is already on multiple medications, adding something like a phosphate binder can be tricky, so simplifying the regimen whenever possible is crucial.
PharMerica also touched on the importance of monitoring lab values and adjusting therapy based on how well phosphorus levels are controlled.
And I liked how they emphasized collaboration between nurses, dietitians, and pharmacists. It's not just about the medication, it's also about diet and overall kidney health.
Yeah, for teams working with residents who have chronic kidney disease, this guide is a solid reference for making sure treatment plans are both effective and manageable.
And that's going to wrap up this week's HealthCap Weekly Wrap.
Yeah, thanks so much for spending some time with us today. We hope these stories give you practical insights to support your residents and your team.
And if you want to dig deeper into any of these updates, you can find all the details in the weekly roundup on Angie's blog at healthcapusa.com/Angie's blog.
We'll be back next week with more news, resources, and stories from across the senior living industry.
Until then, take care and keep making a difference every single day.